All right, this is our patient, Christina. She has done spectacular under upper cervical care. She came in with post concussion syndrome about a year ago, maybe, and she's been doing really well. So I just wanted her to share her story and how upper cervical care has been able to help her.
Yeah, so in my senior year of high school, I was in an accident. I got hit in the face, I got a concussion, a broken nose, whiplash, and so after that I had a lot of headaches, kind of migraine-like headaches, but the doctors just said it would go away in a couple months once my concussion healed. About like 2 or 3 months later, I still had the really bad migraine-like headaches. My arms and legs would go numb. I had back pain, I had neck pain, my neck was really tight, my vision would go blurry. And I also started getting chronic sinus infections, and nobody really knew what was wrong. So I started going to doctors, and over the span of about like 3-4 years, I saw over 30 specialists, and we would try things. They would do diagnostics, they would try medications, and eventually I had a couple doctors say, you know, like, I don't really know what's wrong, but I'm gonna refer you to someone else, and if you find out, like, let me know, because I was always an interesting case, but nobody really knew what was wrong. So eventually I wound up here at Dr. Kevin's office, and I remember my first visit, and I was here and I was telling him everything that I was going through, what I was feeling, and he was smiling, and I was like, oh, okay. But then as I was telling him more, he started filling in the holes in my story. So he started telling me things before I started telling him things, and it was kind of clear that he knew what was going on, and that was like a real good glimmer of hope for me. And ever since, I think I had 6 misalignments in my first 5.
You had a lot going on in your neck.
Yeah.
Like C1 to C5 was all twisted up, yeah.
So when they were shifted, they were compressing on my brainstem and causing all my symptoms. And as Dr. Kevin said, I've been here for about a year now, and I definitely see a difference between when I'm in and out of alignment. I've been doing things that I didn't think I'd be able to do without pain, things that everyday people take for granted. I painted a wall this weekend, you know.
Working the night shift in the ICU again, or now?
Yeah, so it's really just a blessing, and I'm so thankful for everything Dr. Kevin was able to do.
And did you heal overnight?
No, I did not heal overnight. As we said, it's been a journey, and there's a lot of ups and downs, but I think I'm really on the right path, and I'm very thankful for Dr. Kevin for that.
All right, yeah, so upper cervical does really well with post concussion syndrome, and like Christina's story, like my story, true healing does take time. It doesn't take one adjustment and then everything's perfect. It can be a little bit of a roller coaster ride, but if you hold those adjustments, you continue to get better each week and you get your life back. If you are enjoying our videos, hit that subscribe button below, and thank you everybody for watching.